distancing due to federal regulations and recommendations. We are practicing social distancing and hosting a remote Facebook Live chat with Dr. Nicholas Westers. Dr. Westers is a pediatric psychologist who's affiliated with UT Southwestern and Children's Health. And we're really grateful for you taking the time today to answer a lot of questions.
Thank you. Excited to be here.
Yeah, this is such a common topic right now. I know a lot of people, they're locked in their homes, they're frustrated, they can't go out, everything's closed. Could you tell us a little bit about the difference between, quarantine and social distancing and isolation?
Yeah, this is definitely an unprecedented time in our world, really, for the first time, or for most of us, the first time when we're really isolating or distancing ourselves socially. And so a lot of people are hearing different words like social distancing, isolation, quarantine. And isolation is more the separation of people who have already been diagnosed with COVID-19 and from those who are not sick, so as to decrease the risk for other people. Quarantine, and really for the most part, we're doing self-quarantine. A lot of us, where is the separation and restriction of movement of people who have potentially been exposed to COVID-19 in order to determine if they're going to become unwell and affected, and in order to reduce the risk of them infecting others. And so the incubation period for COVID-19, to my understanding, is about 14 days. And that means 14 days symptoms could show up. And so self-quarantine or just quarantine in general is going to be about 14 days where someone that might have been exposed to COVID-19 is going to determine if they show symptoms as well. And then the social distancing is what most of us are doing right now. And that's we're not shaking hands, we're not going out, we're reducing gatherings, avoiding crowds, staying at least 6 feet away from other people in order to reduce the air droplets that COVID-19 oftentimes will travel through and be able to affect others. And so, and most importantly, probably for those that do feel sick, staying at home in order to not affect others.
Right. So I know, most people are inherently social, and we're used to getting out and shaking hands and high fives and hugs. How do you recommend people maintain those relationships when we can't physically be there?
Yeah, I think this is so difficult right now because we're staying physically disconnected, but more than ever, we need to be socially and emotionally connected. And of all times in our world, the beauty of technology actually enables us to do that. There's so many different apps that we can use now. I mean, right now we're doing FaceTime, Facebook Live.
Yeah.
We can use FaceTime. There are other apps that people can use. And so it's so important because we know that social isolation can increase risk for mental health problems, particularly depression, and for some at-risk individuals, suicidal thoughts. And we want to make sure we decrease that. So we need each other now more than ever. And what's different too is we need to focus on that bond and uniting together as a people, as individuals, while separated physically, which is very unique.
Yeah. Right. So, I mean, you've mentioned that in the past that there are certain groups that are more prone to kind of depression. Who are those groups that maybe we should be checking in with a little bit more, reaching out to?
Well, I'm thinking about just the very little bit of research that we know of the effect of quarantine on individuals and their psychological health. There's very little research, and there's some that's just mixed. For instance, those that have a history of a mental health diagnosis are at risk for experiencing additional stress that this may cause. And I think another vulnerable population that we have to think about is our healthcare workers on the front lines. I know we're talking from Children's Health and UT Southwestern, but I'm sure a lot of people that are listening in and watching have family members and friends or that are nurses and physicians, or they are nurses and physicians themselves. And so I think we need to make sure we're checking in on them, because we know from research that that group, especially if they have been exposed and have to engage in self-quarantine, they're at risk for up to 3 years later experiencing significant symptoms of anxiety, post-traumatic stress, and even depression. And then the little bit of research that we're talking about parents and children, children that have been exposed and are having to participate in quarantine or self-quarantine, they're 4 times more likely to exhibit post-traumatic stress symptoms than children who've not been quarantined. And then parents, they're showing similar symptoms as well up to months later. And an interesting group that's actually a little bit more unique is college students. They're very little, a lot of them are at home now doing online classes, and very little research that's looked at college students is that they're pretty resilient in the fact that there's not much of a difference that we know as far as responding and experiencing mental health disorder symptoms based on those who've been quarantined and not. But then again, we don't know why that is, if it's because they possibly have fewer responsibilities, if they're not, if they're full-time students, they're not taking care of children. And then, and there's research showing that duration of self-quarantine or in quarantine actually makes a difference as well. And they found that more than 10 days of quarantine is actually related to mental health difficulties versus less than 10 days. The challenge here is the incubation period, 14 days.
Yeah, I know. We're looking at the 14 days now and several weeks of quarantine, and kids are off of, or isolation, and kids are off of school. And, you know, I know with my own children, they've been talking about, I want to go have sleepovers, I want to have play dates, and I want to go to the park. I mean, what are some symptoms or some things that people should look out for to say that, hey, you really need to find a way to do something with your kids or with their loved ones? What should we look out for?
Well, with our younger ones in particular, changes in sleep patterns. I know a lot of adolescents are staying up later than usual. They're new normal is just like not normal. Everyone's just is struggling in that way. But if there's insomnia and they're not able to fall asleep, it's not that they're just staying up late now because there's not school in the morning at the moment. That's different than going to bed and then really struggling to fall asleep. So if their child or even is not able to fall asleep, that would be one symptom. Significant irritability. A lot of us are feeling it. If we can have a little bit more patience with one another. However, if their child is becoming explosive and physically throwing things, and it's a change in behavior that's even more so than typical stress, that could be a concern. Change in appetite as well. They're not hungry anymore, or maybe they're becoming even obsessive or compulsive about washing their hands. We want to make sure we're instilling these good habits in kids, but those who might have a predisposition towards, say, symptoms of obsessive compulsive disorder that are maybe not actually meeting criteria for a disorder, but sub-threshold, if they're that, they might start to think that germs are everywhere and they can't. They wash their hands to the point of causing like redness and damage to their skin.
I know you touched on this earlier, but with our first responders, because we do have a lot of people in this community that are still, they have to go to work. They can't work from home like I'm doing today. I mean, what can they do to reduce that traumatic stress response that they're most likely dealing with?
I think it's probably more what we can do for them. And I'll mention that in a moment, but I think for them, they know that they're going to need to get their rest. They're engaged in self-care, as much routine as possible, physical activities, exercise, eat well, avoid drugs and alcohol. And actually, there was some research showing that healthcare workers are at increased risk of later substance abuse if they've been quarantined or are feeling actually stigmatized by community members months later. And so making sure that they avoid mood altering substances like alcohol and other drugs, and limiting caffeine as much as possible. But I mean, they're working long hours too, so it's really hard. But I think it's more what we can do for them. We can check them. Social media is just blowing up now with a lot of doctors, nurses holding up signs saying we're at work, so you can stay. You stay home. So we, doing your part, staying home and participating in the social distancing. And
Well, so we are getting some questions in, Dr. Westers, and so I want to take a couple of these while we've got you. So one of them comes in from Christy, and it's that she says that my friends and I have been feeling anxious about many different things with this, getting our parents sick, the possible after effects of all this. How can individuals like Christy manage these fears while staying informed and following those recommendations from the CDC?
Yeah, I think that the connection with your friends is imperative, and family. Again, I mean, like bonding, even if we are physically apart, we still need to maintain those bonds and to stick to routines and take media breaks. I mean, this is constant bombardment, and I have to make sure I need to put the news away, put my phone away for a while, and take a break. And I'm looking forward to this weekend to doing a lot of that. So I think being able to put the news away, but stay connected socially
Yeah,
through these apps. I know people are doing virtual happy hours where they might
they are.
meet up
Yes.
with friends, and being creative to be able to maintain those connections and then
Gotcha.
keep things in perspective. This isn't forever. We have hope. We are a resilient people. In general, I mean, we can look to things happening in China, in Europe, Italy,
Right.
where people like there's just beautiful moments where they're outside, yeah, singing, playing instruments, and still participating in social distancing and maintaining
Yeah.
those connections. And I think that's one
Yeah.
thing for us to remember is to keep it in perspective. I know it's harder for some individuals who may have lost their jobs or are struggling because their businesses have to be closed right now and there's no income coming in. But I think when we can take care of each other, there's also meaning in that. And I think one way to help ourselves is through altruism and reaching out and connecting with others, but also
Okay.
doing things for them, whether that's like bringing some food next door to your elderly neighbors or bringing some supplies to them, but also making sure that we're not in contact with them and maybe leaving it and letting them.
Right. There's a fine line there.
Yeah.
So a couple other questions. Here's one from Mendy, and it's a little long. I'm going to read it. She says, one of her friends is likely positive for COVID-19, was indicated at test site, and so she's been trying to sort out next steps. She's given a one-sheeter, but not a whole lot of guidance on mental health care for how to navigate disclosing this to those who she may have been around prior to showing symptoms. So what can somebody with a positive test, even a potential positive, do to care for themselves while navigating any guilt they may feel from potentially impacting others?
Yeah, that is tough because that's very unfortunate, and that's going to be the experience for so many people probably even watching now. I think following the CDC guidelines and the primary care physician, whoever's providing the medical care is going to be imperative. And one of the things with technology now is for people that are really stressed, really overwhelmed, and this might be a perfect case in point, is utilizing the online telehealth services. Even I know here at Children's we're working on being able to provide teletherapy for our families and patients. But I know community providers, therapists in the community have been doing this for years, and and they have made public that they are allowing or making sure that they're available to do therapy over the phone using the different apps that they have. And so that might be a time to reach out to someone that can listen from a third party.
Gotcha. Good advice. Good advice. Here's a different one. Lots of people. She's a Katrina refugee. Says similar feelings of being powerless. That sounds like that is an emotion that probably many people are feeling right now. I mean, are there ways to feel more? Maybe it's what you were talking about with the altruism, kind of doing what you can. Any other guidance?
Yeah, I think with this the lack of control that all of us feel is really hard. And I have a psychologist friend that says we don't have control, we have options. And I think some of the options we have right now are to recognize again that we're in this together and reach out to each other. And when we feel like we have some control in certain areas, then we feel better equipped to manage the stress. So that for even children and adolescents, I mean, the hand washing sounds simple, but it can go so long. It's such a long way. And I think even the social distancing and staying at home sounds like it's meaningless, but that is like a huge thing that we can do. And I think about the boredom that's just really setting in, also just for children and adolescents.
And adults.
And adults, exactly. That when it's forced upon us, there's no control. Yeah, spring break, that's great. We're excited. But then suddenly I can't go outside. I can't go to school. I can't do all these things.
Right.
A lot of teenagers and children are like, that's good for summer, but now I want to, and I can't. So we don't have control that can really affect us all. And so I think one of those ways is how we message things, how we package the message, and tell people, you're losing your freedoms. You can't go outside. You can't do this. You can't. The things that we can't do, we're going to want to buck the system. We're not going to want to like sit in and follow these lines. However, if we couch it in the message that this is our part, this is how we show kindness, love, and care for our neighbors, our family members that are at risk, or if I've been exposed, it's going to be a really rough 14 days and maybe a very scary 14 days or more. And but being able to know that we can, if we couch it in the message like our duty, or not necessarily our duty, but the ways that we can help and
ways that we can make a difference.
Make a difference is doing the things that are hard, and this is hard. We're all doing our best, and then and lastly, maybe I could say is like giving yourself grace, showing yourself patience. I think we're all maybe a little bit more moody or just and allowing for other people to make mistakes. If someone cuts you off driving, hey, you know, like maybe they're stressed, they're not looking, or if you actually makes a mean comment or your family member does, just giving them extra grace and extending that to yourself, I think can go a long way.
Okay, good to know. So here's a question that I think is right up your alley, and it comes in from Mary, and it's, you know, what's the best way to communicate unknowns to your children who are asking, you know, when do I go back to school? When can I see my friends? Is there going to be pasta at the grocery store? And what is the best way to help children express their fears?
That's also unprecedented here. Usually there's an end date. We have no idea how long we're going to be doing this with the social distancing. It could be weeks, it could be months. And I think that's one of the more difficult things. And I think we can be honest with our kids about just not knowing, but also not dismissing those things as trivial. But we can actually look up the guidelines together, or research reputable news sources together, and use these time with our kids to really curate and critically evaluate what's going on in the news. And there are a lot of great, I guess, like day-to-day structured plans and routines that I've been seeing. And so for being able to share those with your kids. And I think one challenge for some parents is they want to be as honest as they can with their kids. And so they share everything that they know, which may not be as helpful. And actually, if we overshare information, they may not necessarily, especially younger ones, fully understand what we're sharing, and then they're left to filter that information and come to their own conclusions, which could be far worse than an anxiety than what we're communicating. And
and so then how do you help, for the second part of her question, how do you help children express what they're feeling?
Yeah, I think it's okay to check in on them and ask them how they're feeling. These are great for family bonding, creating memories together as families, and having day-to-day conversations with them as far as how they're managing the boredom. And I think one thing that is unhelpful is to simply say, you have one job, and that's to sit on the couch. You know, like do it. Like, this is the generation to do it. I've seen some funny social media memes and things.
The Gen Xers.
they're funny, but when we tell them to our kids, it's pretty invalidating because it's not very helpful when they want to do things. And so it's okay so I think one thing that can go a long way is, and it's okay to do, is validate that I know this is hard. You're doing a great job. How can I help you? Or how are you feeling about everything? Have you heard anything else that might be scary, or that you would like clarification on? And to open that conversation and make sure that these are times that we're talking more rather than yelling at each other more.
Right. So I want to be respectful of your time, but we have a couple questions left, and one of them came in from Christy, and it's, you know, what are some self-care tips and techniques that we can all practice at home as we're dealing with this?
First and foremost, give yourself a break. I think it's okay that you're less productive or less productive than usual. And there's that for those of us that are go-getters and feel like we always have to be doing something productive, and we're not going to be as productive. I think just giving yourself that grace and knowing that neither you nor your children or your spouse are going to be as productive or efficient, and that's okay. And I think we can just take a deep breath with that, which leads me to my next It's taking those deep breathing exercises. There are a lot of videos on YouTube to help coach you through relaxation. get up, do something physical. I know it's been kind of ugly weather here in the Dallas
Yeah.
area for a while, and but when we can, when the rain stops, when the sun comes out, getting out there, getting some vitamin D, going for daily walks with our families, and making it a nice routine where we can get outside. It's okay, even though we're participating in social distancing, it doesn't mean we can't go outside. It might mean that we can't go play basketball with our friends,
Right.
but it doesn't mean we can't go to the park and shoot hoops on our own.
Yeah, so we can do that. We can go. I think we had a question come through about, is it safe to go running? I mean, I think as long as you're not in a group of 20 people running, if you're out by yourself, you can do that. Same with walking.
Yeah, absolutely. Yeah, the physical exercise is going to be great. It's probably not going to be as intense as you might get at the gym, unless you have your own weight equipment or equipment at home. But yeah, in eating as healthy as you can, again, staying away from drugs, alcohol, probably more in these cases, alcohol, with making beverages at home and just staying there.
Right.
Get enough sleep. It's okay to sleep a little bit longer. It's okay for your kids to sleep a little bit longer, even if you may have a plan in place, which is great.
Yeah.
But this is actually a time where they might get the sleep that they need, that they usually don't get because of school.
Right. Gotcha. All right. Last question. This one comes in from Alvaro, and we touched on this briefly, but what are some signs to look out for that may be telltale signs of our kids being stressed or worried if they're not the most forthcoming about sharing their anxieties?
Well, you know your kids best, so you know the change in behavior that might be abnormal in these cases. Of course, they're going to be more socially isolated now, but have they stopped communicating with their friends on social media? I would suspect that's a concern when they may be communicating with their friends now more than ever. Are they staying in the room completely? And is that because they're angry at you, or is it because they're anxious about anyone, even if they don't have to be any reasons to be concerned, or are they again not eating like they normally would? Now, they might not be as physically active, so maybe their appetite has decreased a little bit, but are they eating? Are they not eating at all? And that's something to keep an eye out for. And again, they might be sleeping in a little bit longer, which could might put their bedtime a little bit later. They might have some difficulty falling asleep at night because they're getting more sleep during into the morning. But staying up even later than usual and still getting less sleep and having trouble sleeping. So irritability, outbursts that are very uncharacteristic of your child. But again, you're going to know them best. And so knowing the difference between the subtle changes versus the abrupt, problematic changes, and if in doubt, it's always okay now to consult with a mental health professional. Again, the teletherapy services are everywhere, local here in the DFW area as well as nationally. So.
Okay, good advice. Is there anything that we haven't asked you or that you haven't asked that you want to make sure that we get out during our brief chat here?
I think one of the probably we've addressed it a little bit, but the stigma. I think when this all goes, when we get through this, and we're all back to, I guess, whatever the new normal becomes after this. Still checking in, especially on people that might have been exposed, like the individual that shared that she had been exposed to COVID-19, and checking on them months later. Our healthcare workers, your nurse friends, your physician friends, checking on them months later, because we know that they experienced stigma. And there's that little bit of research that's out there shows that they get uninvited to social events, or they're treated. People start avoiding them. They may make critical comments or treat them with fear and suspicion, and that goes a long way. They feel it, and then they may also feel more anxious around patients who have exhibited fever or other symptoms, and there's loss of work, and so I think for all of us to remember that the people not only on the front lines, but those that have been exposed and had to be quarantined, to once that ends, that anxiety might still be there, and we can check in on them months later. And so I guess that point would be even through Christmas would be good. Always checking in on them and not treating them differently or stigmatizing them because they've been exposed.
Okay, good to know. Good thoughts here. Well, I want to thank you, Dr. Westers, for your time, for answering all these questions, doing this remote chat. I want to thank everybody who participated and who watched today. This chat will be available here on Facebook, and we'll upload it to YouTube. So if you have loved ones that are struggling at this point, please share this with them. Help us get this information out. We're all in a very unprecedented situation, trying to do the best we can. So thank you again, Dr. Westers, and we'll see you soon.
Yeah, hopefully this helps.
I'm sure it will. All right, goodbye. Bye, guys.